Hello everyone, I'm Navneet Dubey from Mint's personal finance team. Today's topic of Why Not Mint Money podcast is: Can Kenko's OPD subscription model fill gaps in healthcare? Before that, I would like to tell you that in our today's episode, we have invited Aniruddha Sen, who is co-founder of Kenko Health, as the expert speaker today.
Hi, welcome to Why Not Mint Money, a personal finance podcast where we help you understand basic money concepts and share strategies for you to build your wealth. So let's get started on your money journey.
Yes, hi Aniruddha.
Hi.
So my first question to you is, how do you define Kenko, as it is not like a regular insurance company?
So it's a bundled health subscription, which covers all sorts of costs. We partner with insurance companies to bring the best possible solution from the insurance world. Then whatever is, not possible within the insurance world or doesn't come under insurance regulations, that we create ourselves, and then we create a bundle of it, so that you don't have to go looking for an OPD solution separately, IPD solution, COVID, something else, etc. Typically, some of our customers have like 3-4 different policies, especially corporate customers. And then someone wants to take a top up and so on. So we bring all of that together. And the net result of it is that when all of it is brought together, it's not just insurance anymore. It becomes an all-round healthcare subscription.
Okay. So all in all, can you tell our listeners what an insurance subscription really is in just 2-3 simple lines?
See, an insurance policy has a technical definition. When you buy an insurance policy from an insurance company, and this is where it gets a little technical. Unfortunately, it is what it is because it's a legal document. So what you're signing with that insurance company is called a contract of indemnity. Indemnity contracts are typically, part of any kind of a vendor contract. Indemnity basically means that the company will make good any financial losses that you may have arising out of any eventuality in the future.
Okay.
That's what indemnification means. And an indemnity contract is different from any other run-of-the-mill sales contract. Because it has certain statutes and certain definitions and certain stage gates that define that indemnity contract. Now, by nature, an indemnity contract is open-ended. So if you look at the definition, it says that you have any eventuality in future and we will cover your losses. But that can't be. So a health insurance indemnity contract will safeguard only for certain kinds of losses arising out of health or health-related emergencies or any kind of health-related situations in the future. So in order to ring-fence that, different companies insert different terms and conditions. So at the end of the day, what you get is a ring-fenced indemnity contract, and it looks very similar. So if you had to create something which was non-insurance but would give you the similar kind of benefit, something similar to what we have done, then it would be more benefits-based, where the benefits are clearly defined upfront and not arising out of some random event in the future.
Okay, so you will pay the exact amount related to doctor consultancy fees and diagnostic tests, etc. For instance, suppose I visit a doctor and he or she charges me rupees 500 per visit. So will I get the exact amount, 500, from the company if I have the subscription?
Depending on which plan you've taken. So there are plans that give you 25%, right up to 90%. So if you have a 500 rupee doctor bill, and you have a 90% plan, then 450 rupees will get paid, 50 rupees you will have to pay.
Okay, straightforward. No hidden charges.
No, it's absolutely straightforward. You come to us, you tell us this doctor I have to meet, what date, time, we'll book the appointment. and you'll get an invoice for the balance 50 rupees. And the discount is passed straight off.
So do you only cover the OPD gap, which one does not get when they buy a regular health policy?
See, out of our own accord, we cover the OPD gap. Now, we have tied up with insurance companies which help us cover the IPD gap. Now, IPD is really not our focal area because that, in any case, insurance covers it to whatever extent. Our focal area is OPD because that's what is not covered.
Okay. So we have to buy a separate OPD plan from your company apart from a regular health policy, right?
No. So the OPD and the IPD are both built into the same one single plan.
Okay.
And
if
that's
we
the
go
beauty
through your
of
route.
Correct. That's the beauty of the health subscription, so that you don't have to go around looking for other things and paying more. If you buy them separately, you'll have to pay more.
Okay. So you will be providing us any particular insurer's product, or you have all the insurers on board?
Even if we have all the, it'll still come from a particular insurance company. But yeah, we have not, we've partnered with select few insurance companies.
Okay.
And you'll get it from one of them.
Okay. So apart from paying the premium, one has to pay the subscription cost to get covered completely.
No. You pay only one subscription cost. Premium, everything is a separate thing. So what we have done is that we have bought group insurance policies for our customers.
Okay.
So every time you subscribe to this thing, you get automatically added on into that group.
Okay. So will there be any waiting period? If it's a group policy?
If you buy our subscription, then there is no waiting period.
Okay.
How do you provide subscription? Are there any questions you ask from the subscribers once they come on your portal to buy your subscription plans?
Good question. The thing is that before you can get the coverage, you'll have to answer a bunch of questions and take a medical test. The results of all of this go into an algo which computes a score. All of that happens automatically.
Okay.
If you get below a certain score, then you will not get the coverage.
So like a score is based out of what? Diseases, or like the way the questions which you ask, it's based on that?
Correct. It's based on that.
Okay.
So financial services companies rely on a credit score, which has things like delinquency, etc.
That is something universal, but in your case, it is yours developed algo, basically.
It's not universal
Totally
in the sense that it's
like people follow. People
companies.
accept. Yeah, people accept all these three scores.
Yeah, correct. Because there is a standardization which has taken place. But even amongst those three companies, the things that they look at, so FICO, what it looks at, and CIBIL, what it looks at, is slightly different. Experian also looks at slightly different things. But ours is less standardized. In insurance, there's no such standardized kind of a system, a ratings agency or anything like that. So as a result of which,
So who are your competitors in the market? Anyone, or like you think you are the first? I don't think like there are certain players who provide this OPD consultancy cover.
Yeah, but those are very perfunctory. So they'll give you a few doctor consultations free, or something free. We go slightly deeper, so we pay for cost of medicines, including life-saving drugs, diagnostic tests, dental, mental, a whole bunch of categories are there within OPD. And it goes up to 90% coverage.
Okay.
So that's a fairly deep kind of coverage. To that extent, no one, even insurance companies, don't cover OPD to that extent.
Okay. So what's the confusion between, there are so many articles being written on this, like there are OPD health insurance cover. So how one should differentiate between them? Like what are the things that one should keep in mind while buying a policy, so they are not misguided by the, all these things?
See, firstly, so if you want to decipher and decode an insurance policy really, really well, you need a deep experience in insurance law. or at least you should have worked in that field for a few years to fully understand. Now, because essentially when you're buying an insurance product, you're signing something called an indemnity contract with the health insurance company. And indemnity contracts, by their very nature, are open-ended. In order to close-end them, insurance companies or any agency has to put certain boundary conditions. Those boundary conditions are terms and conditions. Some of them in technical terms are called sublimits, some are called exclusions, and there are different types of exclusions, specific, named, etc., permanent exclusions, and so on and so forth. So these boundary conditions for you to, and they are written in a fairly legal kind of language. For a simple layman to fully grasp and understand exactly what is meant by it is a little bit of a challenge.
Okay.
Therefore, that's the reason why there is a lot of confusion about what a health insurance policy actually offers.
Right.
Now, someone who's selling a health insurance policy will generally tend to take all the attractive items from the list of offerings and embellish them in their own language. The moment you do that, then you are breaking away from the strict legal sense in which it was written.
Okay.
Second thing, there are some people who sell such insurance policy also tend to tweak the spirit in which some of these things were written, and then it ends up as being mis-selling. So what
technically I can see like lots many insurers have these articles on them, like health insurance plans which covers OPD. Straight away they write this.
Yeah. So then once you get into the terms and conditions, then you'll probably see that the OPD is not as comprehensive as it should be. So it will not pay for, definitely no one pays for medicines as of now. And certainly no one pays for life-saving drugs or critical drugs. So things like insulin and all, which cost a lot.
You mean?
Yeah, which cost a lot of money.
Okay.
Or drugs for chemotherapy and things like that. Most people, I don't think anyone covers in this country right now other than us.
So how should one bridge this gap because a lot of expenses goes in this OPD consultation?
Well, at the very outset, you should consider Kenko because they're the only people who are offering to cover this. But no, how should one bridge this gap?
Yes.
If no one else is willing to pay for those expenses, and this only happens in India, by the way, no other country does this happen.
Okay.
So if no one is willing to bridge these expenses for you, you have no other choice but to create your own financial protection against it. So you have to save for it.
That's the simple answer. Like you have to have an emergency fund. That's it.
You have to have an emergency fund for which you start saving when you are at least 35, 36.
Okay.
And think of it like investing in a mutual fund, this also needs to grow in time, because if you keep money in something like a fixed deposit, it's going to erode. The value of money is going to erode. So that's the simplest answer. Or you might emigrate to another country where everything is pretty much covered.
How will you help people in that case?
As I said,
if somebody has to make an emergency, like create an emergency funds. So in that case, how Keno will help the younger generation? Okay.
We won't. Our thing is that we are ex-health insurance people, and we have some background in insurance pricing and risk management and so on and so forth. So what we've done is we've created a product where no one else is willing to pay for your OPD expenses. We've created a product where we've tied up with different service providers and so on to cover your OPD expenses as a profitable business. And we feel that there is a sustainable business model which is there. It's just that perhaps no one is looking at it very closely. It's a very large business opportunity.
Okay.